Drug-drug interaction (DDI) occurs when the presence of one drug modifies the effect of another drug. These interactions can either enhance or reduce the efficacy of a drug, increase its toxicity, or even lead to adverse effects or therapeutic failure. Understanding DDIs is crucial in ensuring patient safety and effective treatment. There are three main types of DDIs. First, pharmacodynamic interactions occur when drugs affect the same physiological system, either at the same receptor or different receptors. For example, benzodiazepines and opioids can cause increased sedation when used together. On the other hand, NSAIDs can reduce the effect of antihypertensive medications like ACE inhibitors. The second type, pharmacokinetic interactions, happens when one drug alters the absorption, distribution, metabolism, or excretion of another drug. This can occur through various subcategories. Changes in gastrointestinal pH, motility, or binding can affect absorption, such as antacids reducing the absorption of tetracyclines. Distribution can be influenced by competition for plasma protein binding, such as the increased bleeding risk. When warfarin is taken with NSAIDs, metabolism can be affected by induction or inhibition of enzymes, like rifampin increasing the metabolism of oral contraceptives. Excretion can be altered. For example, when probenecid decreases penicillin excretion. The third type, chemical or physical interactions, occur outside the body or in the gastrointestinal tract when drugs chemically interact. An example is the formation of insoluble complexes between calcium and tetracycline. Several factors can influence the occurrence of DDIs. Drug properties such as potency, therapeutic index, and protein binding play a role. Patient-specific factors like age, gender, genetics, and organ function, renal, hepatic, can impact interactions. Polypharmacy, or taking multiple drugs, increases the risk of DDIs. The timing of administration, whether simultaneous or staggered, also affects the likelihood of interactions. There are common examples of drug-drug interactions that we should be aware of. Warfarin and NSAIDs, when used together, can increase the risk of bleeding due to reduced platelet function and anticoagulation. Statins and CYP3A4 inhibitors like erythromycin and itraconazole can heighten the risk of rhabdomyolysis by reducing statin metabolism. Oral contraceptives and enzyme inducers, such as carbamazepine and rifampin, may result in reduced contraceptive efficacy. Combining SSRIs like fluoxetine with MAOIs can lead to serotonin syndrome. ACE inhibitors used with potassium sparing. Diuretics can potentially cause hyperkalemia. To manage drug-drug interactions, a risk assessment should be conducted by evaluating the patient's medical history, current medications, and potential interactions. Dose adjustment, either for one or both drugs, may be necessary if an interaction is expected. By understanding and managing drug-drug interactions, we can ensure the safety of patients and the effectiveness of their treatment.